Hello, I am Dr. Adarsh M. Patil here. Today I am going to explain how the peritoneoscopy procedure will be performed. So this is the peritoneoscope. So this has a screen and the tip has the light source and the camera, and this whole set is disposable. It will come as a pre-sterilized package, and it is once use and throw, and it is to be disposed after single use. This is the port, this is the outer sheet, this is the inner sheet. The tip is transparent, and this is the bulb to insufflate atmospheric air, and this is the port to be placed on the abdominal wall. The peritoneoscopy procedure will be performed at the palmas point. So it is a point in the mid clavicular line, just 3 finger breadths below the costal margin. We will mark this point with a marker. We will take all sterile precautions. We will clean the area with spirit and drape the patient. After that, we will take the scope, insert it into the port. This is a 3 mm port. The breadth of the port is just 3 mm. After giving a local anesthetic at palmas point, we will either give a local anesthetic in the skin, or will also infiltrate and give a transversus abdominis plane block, which is a very simple block to give. After that, under vision, I would introduce the port into the peritoneum. Once I am inside the peritoneum, I will remove the scope and I will remove the inner, and I will attach the insufflator, and I will insufflate the peritoneal cavity with atmospheric air. After that, I will reintroduce the scope inside the port, and I will look inside the peritoneum, and if required, I will pass a biopsy forceps, 1 mm biopsy forceps, and take a biopsy and come out. So that is how the peritoneoscopy would be performed. There is another feature we have, that is we have a port. This particular port will be left inside the peritoneum with we will introduce this, and we will put it inside the peritoneum after any surgery like a laparoscopy or a laparotomy. This port would remain on the abdominal wall of the patient. If we are suspecting any bleeding or anastomotic leak post-operatively, we would again, under sterile precautions, we would insufflate this port with atmospheric air again, and insufflate the peritoneum, and take this scope and go inside and see for any bleeding or any anastomotic leak. So this way we will be able to avoid any unnecessary requirement for laparotomies or laparoscopy, diagnostic laparoscopics for the patient, and this procedure can be done in a OPD or in a bedside setting. Thank you.